You're listening to the Hoofcare Companion, the podcast dedicated to the science, art and practicalities of keeping horses sound from the ground up. I'm your host, Marc, and each episode will take a deep dive into the world of hoof anatomy, pathology, care and rehabilitation. Whether you're a farrier, veterinarian, therapist or simply passionate about horse health, this is your space to learn, question and grow. We'll explore the latest research, time-tested methods and real-world case studies to help you better understand the structures beneath the hoof capsule and how to support them when things go wrong. Because good hoof care isn't just about trimming and shoeing, it's about understanding the whole horse. So let's get stuck into today's topic. Episode 11, Medio-Lateral, Balance of the Hoof.
Introduction.
Medio-lateral balance is one of the most influential and yet frequently misunderstood principles within farriery. It refers to the relationship between the medial and lateral sides of the hoof and limb and how load is distributed across these structures during standing and locomotion. Achieving appropriate mediolateral balance is fundamental to maintaining soundness, efficiency of movement and long-term durability of the musculoskeletal system. While dorsal palmar balance is often discussed in relation to breakover and stride length, mediolateral balance is equally important because it governs joint stability, ligament loading and the uniform transmission of forces through the limb. A common misconception among inexperienced practitioners is that mediolateral balance is achieved simply by making the hoof appear level when viewed from the front. In reality, functional balance is rarely synonymous with visual symmetry. Many horses possess conformational deviations that mean a visually level foot may actually force the limb into an unnatural alignment, increasing strain rather than reducing it. Mediolateral balance must therefore be assessed and applied in a functional context, taking into account the way the horse is built, how it moves, and the work it is expected to perform. Long-standing mediolateral imbalance leads to predictable patterns of hoof distortion, uneven horn production, and adaptive changes within joints and soft tissues. These adaptations may initially allow the horse to remain sound, but over time they often progress to pain, reduced performance, and overt lameness. The role of the farrier is not to impose an idealized foot shape, but to manage these forces intelligently, reducing excessive stresses while respecting the biological limits of the horse.
Static assessment of the horse.
Static assessment is the foundation upon which all decisions regarding mediolateral balance must be based. This assessment should always be carried out before the foot is lifted or altered in any way. The horse should be positioned on a firm, level surface and encouraged to stand square, with weight evenly distributed across all four limbs. Any deviation from a relaxed, square stance should be noted, as habitual postures often reflect discomfort or compensatory loading patterns. From the front, the farrier should assess limb alignment in relation to the midline of the body. The orientation of the shoulder, elbow, knee and fetlock should be observed to determine whether the limb tracks straight or deviates medially or laterally. Base narrow and base wide stances are particularly important, as they significantly influence how load is transferred into the foot. The position of the hoof beneath the limb should be assessed, noting whether it is centrally placed or offset to one side. An offset foot is a strong indicator of uneven loading and often correlates with uneven wall thickness and heel development. The coronary band provides valuable information during static assessment. A level coronary band suggests relatively even loading, while a sloping or undulating coronary band indicates chronic imbalance. The height of the coronary band should be compared from medial to lateral, as a higher band often corresponds to a longer wall and increased weight bearing. The farrier should also observe the hoof capsule for signs of distortion such as flaring, shearing at the heels or asymmetrical growth rings, all of which reflect uneven stresses over time. To assess mediolateral balance through the long axis, the farrier should first position themselves in front of the horse, facing the limb, ensuring the horse is standing square and relaxed. The forelimb is lifted in a straight line, keeping the elbow close to the horse's body to avoid rotation of the limb. The farrier supports the limb just above the fetlock or at the pastern, allowing the foot to hang naturally without twisting or pulling it medially or laterally. The toe should point directly forwards, aligning with the long axis of the limb from the shoulder through the elbow, knee, cannon and fetlock. With the limb held steady, the farrier visually assesses whether the hoof capsule is symmetrical either side of this long axis, comparing medial and lateral wall height, heel height, and overall hoof mass distribution. Any deviation of the hoof away from the limb's long axis may indicate medio-lateral imbalance, whether conformational or acquired. Should there be any medial or lateral lower limb deviations, then the last point of deviation should serve as a reference point for evaluation against the heel heights. The width of the heels, the integrity of the heel buttresses, and the orientation of the bars should all be assessed. The sole should be examined for differences in concavity and depth, particularly at the quarters and heels. Sole callus distribution is especially informative as it reflects where the foot habitually bears weight. A thicker callus on one side of the foot indicates increased loading and should guide trimming decisions.
Dynamic assessment and functional balance.
Dynamic assessment is essential for understanding how mediolateral balance functions in real time. A horse that appears balanced when standing may demonstrate significant asymmetry when moving, particularly under the influence of speed, surface and turning forces. Dynamic assessment should therefore be carried out systematically, with the horse observed at walk and trot on a firm, even surface, both in straight lines and, where appropriate, on a circle. At the walk, the farrier should observe the timing and symmetry of foot placement. The foot should ideally land flat or with a slight preference that is consistent with the horse's conformation. A pronounced medial first or lateral first landing indicates functional imbalance and increased loading of one side of the distal joints. At the trot, these patterns often become more apparent due to increased forces and reduced stance time. The farrier should watch for deviations in limb flight such as paddling or winging, which are frequently associated with rotational limb deviations and medio-lateral imbalance. The stance phase of the stride provides critical information about loading patterns. A foot that rolls excessively from one side to the other during stance indicates instability and uneven support. Breakover should also be assessed carefully, as delayed or asymmetric breakover increases stress on the joints and soft tissues of the limb. Wear patterns on shoes provide valuable corroborative evidence, with excessive wear on one branch indicating prolonged contact or increased pressure. Dynamic assessment should also take into account the influence of the horse's discipline. Horses that work on circles, such as dressage or show horses, experience different mediolateral forces compared to horses working predominantly in straight lines. Driving horses, particularly those working on roads, often demonstrate distinct wear patterns related to camber and surface consistency. Understanding these contextual factors allows the farrier to interpret movement patterns accurately and apply appropriate corrections.
Conformational faults that lead to mediolateral imbalance.
Conformation is one of the primary determinants of mediolateral balance and must be thoroughly understood if corrective farriery is to be effective. Angular limb deviations, such as carpal valgus or varus, alter the direction of force transmission through the limb, resulting in uneven loading of the foot. In carpal valgus, the medial side of the foot typically bears greater load, while carpal varus often results in increased lateral loading. These deviations are often established early in life and may be accompanied by adaptive changes within the joints and soft tissues. Rotational deformities are equally significant. Horses that toe in or toe out present with altered limb flight arcs and asymmetric landing patterns. A toe-in horse commonly lands medial first, while a toe-out horse often lands lateral first. Attempting to trim these feet to a visually symmetrical shape can exacerbate stress by forcing the limb to operate outside its natural alignment. Instead, the farrier must recognise the functional axis of the limb and allow the foot to reflect this, even if it appears asymmetrical to the eye. Base narrow and base wide conformations further influence mediolateral loading. Base narrow horses often overload the lateral aspect of the foot, while base wide horses tend to overload medially. These conformations are frequently associated with compensatory muscular development and altered joint mechanics, which reinforce the imbalance over time. Understanding these relationships enables the farrier to set realistic expectations and avoid overcorrection that could destabilise the limb.
The use of radiography in mediolateral assessment.
Radiography has become an indispensable tool in the assessment of mediolateral balance, particularly in cases where external landmarks are unreliable. Distorted hoof capsules, uneven wall thickness, and adaptive horn growth can obscure the true position of the distal phalanx within the foot. Radiographs allow the farrier and veterinarian to visualise internal structures and assess balance based on skeletal alignment rather than external appearance. Dorsopalmar and dorsoplantar views are particularly valuable for evaluating mediolateral balance. These views allow comparison of the medial and lateral solar margins of the distal phalanx, assessment of joint space symmetry and evaluation of sole depth beneath each side of the bone. Differences in solar margin height may indicate medial or lateral sinking of the distal phalanx, which has significant implications for trimming and shoeing strategy. Radiographs also assist in assessing hoof wall thickness and identifying areas of compromised sole depth. This information is critical when deciding how much horn can safely be removed from the overloaded side of the foot. In many cases, radiographic assessment reveals that what appears externally to be excessive horn is actually providing necessary protection for internal structures. The use of radiography therefore supports a more conservative, precise and welfare-focused approach to correction.
Assessment of the forelimb.
The forelimbs support a greater proportion of the horse's body weight and are therefore particularly sensitive to the effects of medio-lateral imbalance. Assessment of the forelimb should begin proximally with evaluation of the shoulder and upper limb alignment. The orientation of the scapula and humerus influences how forces are transmitted distally, and asymmetry at this level often manifests as uneven loading at the foot. The forefoot itself should be assessed in relation to the limb above, with careful consideration of how the dorsal hoof wall aligns with the pastern. Medio-lateral imbalance of the toe and quarters is particularly significant as it directly influences the stability of the coffin joint and the distribution of forces within the navicular apparatus. In performance horses, even subtle imbalance in the forelimbs can have significant consequences due to the repetitive and high magnitude forces involved. To assess mediolateral balance through the long axis, the farrier should first position themselves in front of the horse, facing the limb, ensuring the horse is standing square and relaxed. The forelimb is lifted in a straight line, keeping the elbow close to the horse's body to avoid rotation of the limb. The farrier supports the limb just above the fetlock or at the pastern, allowing the foot to hang naturally without twisting or pulling it medially or laterally. The toe should point directly forwards, aligning with the long axis of the limb from the shoulder through the elbow, knee, cannon and fetlock. With the limb held steady, the farrier visually assesses whether the hoof capsule is symmetrical either side of this long axis, comparing medial and lateral wall height, heel height, and overall hoof mass distribution. Any deviation of the hoof away from the limb's long axis may indicate mediolateral imbalance, whether conformational or acquired.
Assessment of the hind limb.
The hind limbs function primarily as the propulsive units of the horse, generating impulsion and forward motion. Mediolateral imbalance in the hind limbs therefore affects not only soundness but also performance and engagement. Assessment of the hind limb should consider alignment from the pelvis through the femur, stifle and hock, as deviations at any level influence how forces are transmitted to the hindfoot. Viewed from behind, the farrier should assess whether the horse is cow-hocked, bow-hocked or base narrow. Cow-hocked horses often overload the lateral aspect of the hindfoot, while bow-hocked horses may overload medially. These loading patterns are frequently reflected in asymmetrical heel development and uneven wear patterns on the shoe. The hock joints should be examined for signs of uneven stress, such as joint enlargement or reduced range of motion. To assess mediolateral balance of the hind hoof through the long axis, the farrier stands slightly to the side of the horse, facing the hind limb, maintaining close body contact for safety. The hind limb is lifted straight back from the hip, not pulled out to the side, to avoid inducing rotation within the limb. The farrier supports the limb just above the fetlock, allowing the cannon bone to remain vertical and the foot to hang naturally. Care is taken to ensure the limb is not abducted or adducted, as this would distort the true long axis. With the limb held steady, the farrier visually aligns the long axis from the point of the hock and down the cannon, assessing whether the hoof capsule sits evenly either side of this axis. Medial and lateral wall height, heel height and hoof symmetry are compared. Dynamic assessment of the hind limbs is particularly important, as imbalances often become apparent during push-off rather than landing. The farrier should observe whether the horse pushes evenly through both sides of the foot or whether one side dominates. Hind limb medio-lateral imbalance can also influence straightness, with affected horses often drifting or struggling to maintain alignment during work.
Pathologies associated with medio-lateral imbalance in the front and hind limb.
Chronic medio-lateral imbalance is associated with a wide range of pathological conditions affecting both the forelimbs and hind limbs. In the forelimbs, uneven loading of the foot increases stress on the collateral ligaments of the coffin joint, often leading to dysmitis and chronic lameness. Asymmetric joint loading also contributes to degenerative joint disease within the distal interphalangeal joint, particularly on the overloaded side. Long-standing imbalance can also contribute to uneven wear of articular cartilage, accelerating degenerative changes. In the hoof capsule, chronic imbalance often leads to sheared heels, quarter cracks, and asymmetrical wall growth, all of which further destabilize the foot. In the hind limbs, mediolateral imbalance is commonly associated with proximal suspensory desmitis, particularly when uneven loading increases strain on one branch of the ligament. Hock joints are also affected, with asymmetric loading contributing to osteoarthritis and reduced joint mobility. Over time, these distal imbalances can influence more proximal structures, including the stifle and sacroiliac region, as the horse compensates for discomfort by altering movement patterns. Soft tissue structures throughout the limb are influenced by mediolateral imbalance. Tendons and ligaments adapt to uneven loading by altering fibre alignment and tension, which may initially maintain function, but ultimately reduces resilience and increases injury risk. Recognizing these associations highlights the importance of addressing mediolateral balance proactively, rather than waiting for overt pathology to develop.
Trimming techniques to overcome mediolateral imbalance.
Trimming is the primary means by which the farrier influences mediolateral balance, and its success depends on precision, restraint, and an understanding of functional anatomy. The objective is to establish a stable, supportive base that allows the limb to load as evenly as possible within the constraints imposed by conformation and pathology. This begins with identifying the true weight-bearing structures of the foot, particularly the sole callus and heel buttresses. When addressing imbalance, the farrier must decide how much horn to remove from the overloaded side and how much support to retain on the underloaded side. In chronic cases, aggressive reduction of the overloaded side can result in soreness and further compensatory movement. Gradual correction over multiple shoeing cycles is therefore preferred, allowing joints and soft tissues time to adapt to changes in loading. Preservation of sole depth is critical, particularly on the overloaded side of the foot. Excessive removal of sole or wall can compromise protection of internal structures and exacerbate discomfort. Trimming should also aim to optimize breakover in a medio-laterally balanced manner, reducing leverage on the overloaded side and encouraging a more symmetrical stance phase. Frequent reassessment throughout the trim helps ensure that changes are producing the desired effect.
Shoeing options used to correct mediolateral imbalance.
Shoeing provides additional tools for managing mediolateral imbalance when trimming alone is insufficient. One common shoeing approach is the use of a level shoe with precise foot preparation. Minor imbalances may be managed by adjusting hoof wall height and ensuring even heel support. In cases where one side of the foot is consistently overloaded, the farrier may fit the shoe with slightly increased width in relation to the hoof shape on the overloaded side to increase ground contact and encourage more even weight distribution. Specialist shoes are often required in more complex cases. The spiral lift shoe is designed to apply a gradual change in height across the foot, allowing controlled redistribution of forces without abrupt alteration of limb alignment. This type of shoe is particularly useful in horses with angular limb deviations, as it respects the functional axis of the limb while reducing excessive loading. Bar shoes are valuable for stabilising the hoof capsule and increasing the surface area of support. Straight bar and egg bar shoes reduce independent movement of the heels and quarters, which is beneficial in horses with mediolateral instability or associated soft tissue injury. A heart bar shoe may be considered where frog support is desirable and the frog is healthy enough to bear load. By transferring some weight from the heels to the frog, the imbalance can be reduced. This option requires a high level of skill, as incorrect frog pressure can exacerbate pain rather than relieve it. Pads may also be used to fine-tune balance, particularly when sole depth is limited. Graduated frog support pads allow subtle adjustment without excessive horn removal and provide additional protection during periods of transition. The leather and/or synthetic properties of the pad can provide anti-concussion to the hoof and coffin joint, especially when combined with a soft-setting impression material compound underneath the pad. Graduated pads can also be modified on a grinder to create a spiral lift and help to establish a level footfall. In some cases, this spiral can be gradually reduced as the medio-lateral balance improves and the hoof begins to load evenly.
Conclusion.
Medio-lateral balance is a dynamic and complex aspect of farriery that requires a deep understanding of anatomy, biomechanics, and equine movement. It cannot be reduced to visual symmetry or a single trimming technique, but must be approached as an ongoing process tailored to the individual horse. Through careful static and dynamic assessment, informed use of radiography and thoughtful application of trimming and shoeing strategies, the farrier can significantly influence limb loading and long-term soundness. While conformational limitations may prevent perfect balance, meaningful improvements can be achieved that reduce strain, enhance comfort, and prolong the working life of the horse. Excellence in managing mediolateral balance lies in recognising that the hoof is a functional structure shaped by the entire musculoskeletal system. By working with this system rather than against it, the farrier plays a crucial role in promoting equine welfare, performance and longevity. Thank you for listening to the Hoofcare Companion. Please follow, rate and share this podcast on your social media to help the Hoofcare Companion grow and reach all of those who care for our equine friends all around the world. Visit the links in the show notes to obtain your copy of my books or to interact on my social media channels. Until next time, thank you for listening, because a healthy hoof is a happy horse.